Hello everybody, welcome to the Thursday edition of Video Clips. And reminder, less than 2 months away, the fall conference, November 8th through 10th, featuring Dr. Colin Campbell, Dr. Alan Goldhammer, Laura Theodore, the Jazzy Vegetarian. Lots of wonderful speakers and a great weekend in Columbus, Ohio. Make sure you're here to join us for that. All right, I want to talk about complementary and alternative medicine today. I enjoy reading discussions and debates among physicians in newsletters and on blogs and websites. Many are interesting. They provide a lot of insight into what doctors are thinking, and sometimes it really explains why it's so hard to change the system and get people to talk about new ideas. So I recently read an article posted on Medscape about complementary and alternative medicine, or CAM, a topic about which there is still a great deal of discussion and debate and name-calling and all kinds of negative things going on. Some docs think that many CAM therapies are effective and should be incorporated into medical practice. They cite patient demand as a reason. You can only ignore the wishes of customers. I mean, patients are customers for so long before they just go elsewhere. And they're also concerned about lack of efficacy and harmful side effects for a lot of traditional medical treatments. So there's a medical camp that's kind of open-minded about this stuff. Then on the other side of the issue are docs who think that anything that's not traditional allopathic medicine is quackery. And that includes the use of diet to prevent, stop, and reverse disease. And the Medscape article included both of those points of view and then somebody who weighed in the middle. So I'm going to share that with you, and I'll close with my ideas on the topic. So first, let's define CAM. The National Center for Complementary and Alternative Medicine, which is part of the National Institutes of Health, states that CAM is, quote, a group of diverse medical and healthcare systems, practices, and products that are not generally considered part of conventional or allopathic medicine. Alternative medicine refers to the use of CAM instead of what is considered conventional medicine. Now, some CAM therapies have gained wide acceptance. For example, acupuncture. Acupuncturists are even licensed now in those states. But then part of CAM also includes alternative diagnostic testing, like muscle testing for nutrient needs. And I think part of the problem and what fuels the debate is that CAM has come to represent such a broad and diverse group of ideas and modalities that you really can hardly wrap your arms around it. It means many different things to many different people. Now, let's start with the players here. Dr. Aditi Nerurkar is the head of an integrative care center in Boston, supporter of CAM. Dr. David Gorski is an associate professor of surgery at Wayne State. He's the skeptic. They disagree about a lot of things, but they do agree that patients or the doctors have to be careful when they're discussing this issue with their patients for two reasons. First is there's little scientific evidence, and even Nerurkar agrees with this for a lot of these practices. And the other is that if you're completely negative and you won't have the discussion, you can and do alienate patients. Now, Nerurkar heads an integrative facility, so she's obviously the open-minded one, and she does use CAM in her work. She's cautious, but she uses things like yoga and meditation. Gorski, on the other hand, refers to CAM modalities as quackery. In my opinion, just based on what he said in this article, he's the poster child for the arrogant doctor who won't consider anything else. He further adds that many of his colleagues agree with him but don't say so. And this is his direct quote. He said, "They know it's BS, but they don't want to do anything about it." I just love how he lumps it all together into one category. None of it's worth considering. I suppose he can save himself a lot of time doing research and learning anything new, which apparently a lot of doctors still are in that camp. Now, some background is helpful in understanding how a guy like Gorski gets to be so closed-minded. What causes this level of arrogance? And it really goes back to some history of the AMA. The American Medical Association used to have a rule, actually, that doctors were to have nothing to do with alternative medicine. For 30 years, Section 3 of the AMA Principles of Medical Ethics stated, and this is a quote, "A physician should practice a method of healing founded on scientific basis, and he should not voluntarily associate professionally with anyone who violates this principle." My gosh, doctors who associated with the Wellness Forum would have been in violation of the AMA rules. So as a group, they totally discounted anything other than conventional medicine. But a couple things happened. In 1980, the AMA had to change its stance due to a lawsuit brought against the AMA by a chiropractor. This litigation went on for about 14 years, but throughout the whole thing, the chiropractic profession was able to prove that the AMA had engaged in a systematic effort to discredit the chiropractic profession. And that was one of the things that led to the recognition of chiropractors and got them licensed in all states now. The other thing that changed things was the Dietary Supplement Health Education Act, or DSHEA, that allowed supplement makers a lot more latitude to market their products without having to test them in the same way that drugs are tested. So, like it or not, medical doctors had to face the fact that alternative practices, and by the way, they discounted chiropractic as being an alternative practice that should be shunned and looked down upon. So they had to change their ways a little bit because the landscape was changing in America. Of course, Gorski, back to him, he couldn't resist as he's talking about his disdain for alternative medicine, Steve Jobs, and his choice to postpone conventional treatment for a while for his pancreatic cancer. Of course, he doesn't weigh in with the other side, which is that treatments for pancreatic cancer are notoriously ineffective. I did a newsletter on this topic. I won't regurgitate all of it here, but the bottom line is that Steve Jobs not having traditional treatment right away was not the difference between him living and dying. But anyway, the guy in the middle, Terry Snyder, a family doc, expressed a refreshing point of view. He said that this just doesn't need to be so hard and that discussion and research are important. He says you need to keep your priorities in mind. First, do no harm, and then look for evidence that backs up the claims. He adds that he asks patients about their use of CAM, since patients don't want to bring it up sometimes, and of course one of the reasons is their prior association with docs like Gorski. He takes the further step of contacting providers to learn more, and he says he doesn't think it's a really good idea to try to talk patients out of all CAM treatments, particularly if there isn't any evidence of harm. And so a much more reasonable point of view. The article does mention one thing that this blows my mind still. The AMA considers the use of or the sale of nutritional products or supplements to be a conflict of interest for doctors. And I find that fascinating. It's okay for doctors to be entertained by drug reps. It is okay for doctors to get fees for enrolling patients in clinical trials. It's okay for them, for high prescribers, to be paid to present, make presentations to doctors in exotic and luxurious locations for CME programs, but bad idea to sell nutritional supplements. I'm not wild about nutritional supplements, but come on. You're honestly going to tell me that that's the problem in doctors' offices? Well, I said at the beginning I would give you my take on it. My own take on CAM, and this includes the use of diet, is that the problem is not CAM and whether or not to use CAM practices. It's much bigger than this. It's the refusal of people in all branches of medicine to use evidence to dictate the choices that they make. Doctors like Gorski ignore the evidence that diet may be a better option than some of the surgeries he's teaching his students to do. And CAM people are just as ignorant about a lot of things. They refuse to look at the evidence that shows that what they're doing to help patients with isolated nutrient supplements isn't helping patients. Most approaches to medicine, whatever camp you're in, are bad ideas because they're not supported by evidence. And the issue is not choosing between the camps, but choosing the tests and treatments that really do lead to better health outcomes based on the scientific evidence. So this is an interesting debate, but what should have been the debate, in my opinion, is the various factions bringing forth evidence for discussion instead of everybody talking about what they think and what they believe. What I believe? Meaningless. What the scientific evidence shows is what we should be focusing on. All right, well, that's it for today. As always, feel free to pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week.